This video aims to educate you on the drug zopiclone. Throughout the video, we're going to look into what type of drug zopiclone is, what zopiclone is used for, how it was discovered and developed into a drug, its mechanism of action, and finally, the main side effects of the drug. So this is Xavier. Xavier is a pharmacy student. He's very stressed, and it dawns on him that he's not been able to sleep for a few nights now, and he thinks this is a problem, so he decides to go and see his GP. Insomnia is essentially sleeplessness. It can include difficulty falling asleep or staying asleep for long enough that you feel refreshed the next morning. As adults, we're required to get between 7 and 9 hours of sleep per night. And if we do not get this, it can cause detrimental side effects to our body. There are 3 main types of insomnia. The first being transient insomnia. This is caused by things such as noise disturbances, shift work, or even jet lag. These things mess with your body's natural body clock and can sometimes lead to difficulty falling asleep. In the case of transient insomnia, a very short-term treatment with a hypnotic such as zopiclone should be used to help the condition. The second type of insomnia is chronic insomnia. This is usually drug and alcohol induced, but it can also arise from depression or anxiety. Hypnotics would not usually be used to treat this type of insomnia, as it is caused by an underlying issue, and it would therefore benefit the patient to identify the issue, treat the issue, and eventually the insomnia will be resolved as well. The last type of insomnia is short-term insomnia. It's probably the most common type. It's insomnia induced by stress, which is what Xavier is suffering from, emotional events such as death or trauma, and can also be an effect of a serious medical illness. In this case, zopiclone would be used for up to 4 weeks. Xavier receives his prescription of zopiclone from the doctor, but he's still eager to know more about the drug, so he goes home and researches. In 1964, Roane Poulenc carried out a broad random screening program aimed at the search of anxiolytics. From their 3,000 lead compounds screened, they discovered zopiclone, a cyclopyrrolone hypnotic. Zopiclone was the first compound developed which is chemically unrelated to benzodiazepines, yet binds with high affinity to benzodiazepine receptors. Between 1987 and 1989, the different protein subunits that make up the receptor for the inhibitory neurotransmitter gamma-aminobutyric acid, GABA, were identified as alpha, beta, gamma, and delta. These relate to the specificity of drug receptor binding. Zopiclone specifically binds to the alpha subunits, as will. Zopiclone has been sold in France since the late 1980s. In 1999, Avantis Pharmaceuticals, which is now Sanofi, rightly owned the preclinical, clinical, and post-marketing data package for zopiclone, its isomers, and its metabolites. In 2004, US FDA approved S-zopiclone under the brand name Lunesta for the treatment of insomnia. This was after around 24 clinical trials that included more than 2,700 adults and elderly subjects, as well as data from more than 60 preclinical studies. In 2005, S-zopiclone, the active S-enantiomer of zopiclone, arrived in the market. It's supposed to have equivalent efficacy with racemic zopiclone and possibly fewer side effects than that of zopiclone.
There are a lot of methods in synthesizing zopiclone, in particular the last stage of the synthesis. However, in this video we are going to talk about the traditional way only. So the starting material of the synthesis is pyrazine 2,3-dicarboxylic acid. It starts with dehydration of it in the presence of acetic anhydride in toluene to give pyrazine anhydride. After that, condensation occurs by combining pyrazine anhydride with 2-amino-5-chloropyridine through nucleophilic acyl substitution to give an amide with a yield of 92%. The process is undergone in acetonitrile at reflux temperature. Next, an imide is formed by the cyclization of amide with the aid of thionyl chloride at reflux temperature with the yield of 77%. The fourth part of the synthesis is completed by the monoreduction of carbonyl oxygen of the imide to a hydroxyl group with a product, a yield of 64%. This route is mediated by potassium borohydride, dioxane, and water. The final step of the synthesis is by condensing the product which is produced from the last step through a substitution in the presence of sodium hydride, dimethylformamide, and 1-chlorocarbonyl for methylpiperazine at negative 10 degrees Celsius to eventually give racemic zopiclone. The yield of this step is measured at 43%.
Once finished with his research, Xavier takes his prescription to the pharmacy and is told about the side effects and how and when to take zopiclone. The pharmacist tells Xavier that the dose he should take is one 7.5mg tablet at bedtime. The most common side effects include a bitter or metallic taste in your mouth, a dry mouth, and daytime sleepiness. The pharmacist also tells Xavier if you feel drowsy in the morning, do not drive. These side effects are common, but not everyone will experience them. These side effects occur because zopiclone binds to the GABA receptor at the benzodiazepine binding site at positions alpha 1, 2, 3 and 5 as a full agonist, causing an enhancement of the inhibitory actions. Research shows that the alpha 1 subunit is associated with sedation, the alpha 2 and 3 subunits are associated with anxiety, and the alpha 5 subunit is associated with temporal and spatial memory. In this case, alpha 1 subunit receptor is the intended receptor, whereas the alpha 2 and 3 and alpha 5 are the unintended receptors. However, even though the alpha subunit is the correct receptor, when taking an overdose of zopiclone, it may present with excessive sedation and depressed respiratory function, which may progress to a coma and possibly death. There is also a relationship between high GABA levels and depression, which makes sense that GABA typically promotes a calm, relaxed mood, but being too calm can turn into indifference and apathy, hence why a patient may feel dizzy, lightheaded, or faint. Zopiclone is generally only suitable for short-term use, i.e. less than 4 weeks. If it's used for longer periods, dependence upon the medicine may develop and withdrawal symptoms such as headaches, muscle pain, sweating, tremor, anxiety, tension, restlessness, confusion, and irritability may then occur if treatment is stopped suddenly. The human body may also become tolerant to zopiclone, which means high doses would be needed to achieve the same effect. For this reason, zopiclone should be taken with caution, as directed by the prescriber, and at the recommended dosage. It should also be weaned off slowly, rather than abruptly stopped.
Xavier has now taken 7.5mg of zopiclone, and we can now start to understand the mechanism of action and see how it is used to treat insomnia by looking at the structure and activity of zopiclone. As you can see, it is a small molecule with a log P of 0.8. It has 6 hydrogen acceptors and no hydrogen donors. The molecular weight is 308.8. This means that zopiclone fits all 4 of Lipinski's rules, and for this reason it is orally available, most commonly as a tablet. It displays ionic interactions, pi-pi stacking and hydrogen bonding, and so these would be the factors considered when looking at its activity on the benzodiazepine receptors. There is no precise mechanism of action known for zopiclone, but we can establish that its action is closely related to its ability to bind to the benzodiazepine receptor complex. Let's focus on the GABA receptor. There are neurons in the central nervous system that use the amino acid GABA as a neurotransmitter, which is unique among amino acids in that it is manufactured almost exclusively in the brain and spinal cord. GABA acts as a natural tranquilizer, mitigating the stress response and lowering anxiety levels as well as slowing down functions of the central nervous system. This means that when these neurons fire, they secrete GABA into their synapses. When GABA receptors are stimulated by the presence of GABA, they typically inhibit the postsynaptic neuron from firing. When GABA A binds to the receptor, it allows the flow of chloride ions through a special channel in the membrane. This flow causes inhibition of the neuron from firing. In addition to a site for GABA, the GABA receptor has a site for zopiclone molecules too. When the molecules are present on GABA receptors, they increase the efficacy of GABA to bind to the receptor. However, zopiclone binds with roughly equal affinity to GABA A receptors containing different alpha subunits and therefore cannot discriminate the GABA-dependent behavioral pharmacology effects by selective action via GABA A receptors containing alpha subunits, specifically related to sedation, anxiolytic and other effects. When the receptor is activated, this forces chloride channels to open, causing negatively charged chloride ions to enter the postsynaptic cell. This makes the neurons less responsive to stimulation by hyperpolarization of the membrane potential. The widespread distribution of GABA receptors suggests that the brain is generally in a state of inhibition, stabilizing membrane potentials and dampening excitatory input. This is why zopiclone can treat other conditions such as epilepsy, anxiety, and even as a muscle relaxant. Zopiclone only binds to the benzodiazepine receptors as they have a very high affinity for the drug, and so is a much safer option for treating insomnia as it presents with fewer side effects when compared to other Z drugs such as zolpidem.